Hello, Mr. Richardson, is it?
Good morning, Doctor.
My name's Dr. Alderson.
Oh, right.
I've been asked to come and speak to you about your father.
Yes, he's not so well, is he, at all? You
No.
know, he doesn't look good, and he's on this ventilator thing.
Yeah, that's right. So I wondered whether, for a start, you might start by telling me what you understand about what's happened to your father.
Well, I mean, immediately, he came in earlier today, and, he's having quite a bit of breathing difficulty recently. He's had it over a number of years, it's the smoking, although he has packed it in now. But he has been having more breathing difficulties recently, so I've been sort of trying to keep a closer eye on him. And when I called in this morning, he was really having difficulty breathing. So I brought him down, straight away, and he's been admitted. But in the longer term, I mean, he has had problems, high blood pressure and heart bypass and what is it you call it, COPD, I think, isn't it? Because again, with the smoking. So his health is, not particularly good, to be quite honest. But at the moment, as I say, it's this breathing thing. So, and he's on this ventilator, and it's very worrying.
Yeah, okay, so it sounds as though he's got quite a few health problems there.
He has. He has.
And so he's not been very well for a couple of days then at home?
No, it's this breathlessness, so something's getting worse, obviously.
Yeah, and has anyone explained to you at all about what the current problem is since, what we found?
No, not really. They just said they were sort of trying to make him comfortable and sort the immediate problem out, but what's brought it on, I don't know.
Okay, so maybe then I should start by telling you a bit and updating you a bit about what's happened. So obviously, by what you've told me, your dad's been unwell for a few days.
Yes.
When he came into hospital, he was obviously quite breathless.
He was very much.
And the high temperature as well.
Yeah. Oh dear. Yes. Well, I didn't check temperature or anything. Yeah, but it doesn't surprise me.
And from the tests that we've done, sort of some blood tests and also an X-ray test of his chest, it looks as though he's actually got a pneumonia. So a sort of a...
Pneumonia?
Yeah.
That's not a good thing, is it, for an older person, is it?
No, I mean, pneumonia can be serious for anyone, really. It can be more serious in an older person.
Yeah, that's what I thought.
So that looks as though that's what the problem is.
Right.
And so he's been started on some antibiotics to treat the infection. And the other treatment he's having, which is something you've already mentioned to me, this ventilator mask.
Yes.
And that's really just giving him sort of some extra oxygen and some extra help with his breathing.
This is only temporary, isn't it? I mean, he'll be coming off that presumably.
Yeah, well, it's to help him really while he's got this infection. If he didn't have that on, he just simply wouldn't be getting enough oxygen into his lungs. He'd be getting more poorly, really. The sort of the situation we're in at the moment is, even though we've done that and we've started him on the antibiotics and we've put him on the special ventilator mask,
right,
things haven't really got better quite as quickly as we might have hoped.
Oh, right. So we're looking at a fairly serious situation here then.
Yeah.
I mean, you mentioned pneumonia. I mean, I know it's early stages, but I mean, he's going to survive this, isn't he?
As I said before, pneumonia is a very serious condition. It's serious in someone who's young and obviously someone who's a bit older, like your dad, and who's got all those other health problems as well.
Yeah, I was going to say, not in good shape,
It's more serious.
Right.
And so, it's really difficult to be certain, exactly how things are going to go. The thing that really I wanted to talk to you about now is about what we're going to do next.
Right, okay.
And as I already mentioned, he's on this special ventilator mask.
Yes.
But really, despite us doing that, it looks as though there's not enough oxygen getting to his lungs still. Okay, so that's not doing quite enough.
No.
And so what I think we need to be doing is thinking about a different type of breathing machine, so a different type of help with his breathing.
Right, okay.
And what we've asked is for the intensive care doctors to come and have a look at your dad.
So this is all pretty serious then, isn't it?
Yeah, I'm afraid it is, really.
Yeah.
As I said, pneumonia is a serious problem. And it looks as though things haven't got better with the treatment we've given so far, or better as quickly as we might have hoped. And we're now in a situation where we need to do a little bit more than what we're doing.
I mean, do you think he's... Well, I mean, presumably, actually, you haven't said it, but you think he's actually getting worse?
I think he hasn't got better as quickly as what we might have hoped. That's the the thing, really. And so instead of him improving with this treatment, he's really struggling with his breathing now, and he's getting quite tired. And when we check his blood test, it shows that the waste gases in his blood are rising, and that just really suggests to us that he's not breathing as effectively as we might hope.
No.
So I think the next step really is to get the intensive care doctors to come and have a look at him.
Yes.
And to think about transferring him there for him to be put on a breathing machine, on a ventilator machine, to really take over his breathing and to do that for him whilst things hopefully get better from the pneumonia.
So you think there is a chance of improvement and him getting better?
Yeah. If we thought the situation wasn't going to improve and there was no hope, we wouldn't be doing this. We wouldn't be transferring him to intensive care and doing all this extra treatment. So we do think there's a chance. And I think there's a good chance that things might get better.
Yes.
But that's by no means certain.
No.
And as I said, before, pneumonia is a serious condition for anyone who gets it. But if you're that bit older and you've got all those other health problems as well, it is even more serious. And although we're doing all we can, and we're going to send him to intensive care hopefully, and he can have this extra help with his breathing, that's no guarantee, unfortunately.
No. Supposing that you intensive care people do manage to bring about an improvement, and supposing I presume they could get him well enough to come home again, and that happened. I mean, what would the general longer term outlook be? I mean, he's 70 now, which is not too bad an age these days. But on the other hand, given his health condition, what would you imagine would happen in the future?
It's very difficult to say. Some people, recover very well from an intensive care stay, and and they can get back to where they were before.
Yeah.
That doesn't always happen.
No. No.
It's only people who are seriously ill go to intensive care, and it's obviously some of those people don't survive, and there's a chance that might be the case here. And some people, it takes a lot out of them, and they don't manage to get back to quite where they were before.
No. I mean, how soon do you feel that the intensive care people will have some idea of whether he is improving or otherwise?
I think they'll be able to give you a much better guide. I think the important thing is for him to be transferred there, and for them to be able to stabilise him.
Yeah.
But really, the next hours and days are going to be very important in seeing how things go. And he is very unwell, and it's difficult to know.
Probably his situation is rather worse than I even imagined. I know he's struggling this morning with the breathing, which is why I brought him in. But I hadn't realised, about the pneumonia and things. So, I hadn't realised quite how serious it was. But yeah. Well, I'll just have to hope that somebody can, not exactly work a miracle, but get him back on the straight and narrow again.
And that's what we obviously hope for as well, and that's why we're doing all this treatment, is the aim of getting things better, really.
Well, yes, no, that's very good.
But
that's very good.
We just have to be a little bit guarded in that and just see how things go, really.
Well, I think you've made it pretty clear where we are, so okay. Right, well, it's just a case of waiting to see, like you said, in the next day or so where we are.
Yeah, so the intensive care doctors will, be along shortly, have a look at your dad, and then obviously they'll be able to have a chat to you then if you've got any more questions about things.
Yes, okay, well, I'll probably have thought of something. But
and obviously, when he is transferred there, then, you'll be able to go and see him there, and again have an opportunity to talk to the team there. Do you have any more questions at all for me at the moment?
Nothing I can think of. No, I think you made it pretty clear. So, and as I say, you've been pretty honest as well. So, No, thank you very much, Doctor.
Okay.
Thank you.
Well, if you do think of anything else you need to ask, I will be around.
Yes.
The nurses can always contact me. And similarly, if you've got any relatives or friends who you'd like
Oh,
us to
yes,
speak
that's
to.
something else to do, the phoning round.
Yeah.
I'll have to make a bit of a start,
Yeah.
yes.
We
Okay.
can obviously help there as well.
Right, okay.
Okay.
Thank you.
All right.
Okay.
Thank you.
Doctor.
Thanks very much, Helen. Could you just quickly summarise for me what you discussed there?
Well, I discussed with the patient's son about his father's condition. I explained that he had pneumonia on the background of a number of comorbidities. I then went on to explain that his condition was deteriorating, and so he was going to be reviewed for transfer to intensive care for ongoing management.
Okay, great. And when you were discussing this, I'm sure you were considering the 4 ethical principles.
Yes.
Could you just tell me what those principles are?
So the 4 principles are firstly beneficence, or the duty to do good, non-maleficence, or the duty to do no harm, and then autonomy, so considering a person's right to make a decision for themselves and for their own healthcare, and also thinking about justice both for the patient and for the wider public really as well.
Okay, that's great, thank you. And which of the principles do you think were most important in this discussion?
So I think in this particular case, beneficence is important. Obviously, you're thinking about caring for the patient in the best possible way, and here the patient lives alone. He has reasonable quality of life with a number of comorbidities, but it's felt that he would benefit from an intensive care stay, and so considering him for transfer is certainly highlights that principle of beneficence. And also and the flip side of that, weighing that up and not transferring someone to intensive care who has no prospect of survival, so he doesn't fall into that, so obviously
so that's considering non-maleficence and justice at the same time, isn't it?
Yeah.
Okay, thank you very much. The most important parts of this scenario are conveying the information in an accurate and honest manner, whilst accepting that there is some uncertainty in the scenario. What was most important here was making it very clear how unwell the patient was, acknowledging that there's a duty of care to try and treat him in the best way possible, however, that the prognosis remains uncertain.